Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions to make a better system for all of us. Today, we're going to be talking about pharmacy benefit managers and medical school. But before we do, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter, a mostly daily newsletter, and the link there is the text for today's lecture. And in that newsletter, you'll find all of the hyperlinks for all the studies and news articles and actions. Everything is in there, and you can subscribe for free and have this stuff delivered into your inbox every day. Okay, so let's get started, because when I started writing today, I got to tell you, livid was not the right word. I was so angry. Congressional funding is going to run out for a lot of major programs this week on Friday. Today is Tuesday. This is because more than half of the House of Representatives and nearly half of the Senate wants to upend democracy instead of improving the lives of their constituents. My blood pressure just skyrockets when I say it. Anyway, I want you to recall what a pharmacy benefit manager is. It is a company that runs a prescription portion of a health insurance plan. They are largely responsible for deciding what drugs will be available to you and how much you should get to pony up in copays. They do this by taking bribes from drug manufacturers. Those are called rebates. And they also put the screws to the drugstore, demanding that they accept low reimbursements, sometimes below cost. And then they screw the insurance company by having them pay more than the drugstore received. I'm telling you. Anyway, it's worth noting that 3 companies control about 90% of the U.S. insurance prescription market. Some of them even own their own medical networks, like where the doctors are, and they even own their own health insurance companies. CVS is one of the biggest ones. So they own the drugstores, they own the pharmacy benefit managers, they own an insurance company, and I think they also have a medical network of doctors. It's incredible. Anyway, there are a lot of bills at the federal level to try and control pharmacy benefit managers. Now, all that has gone by the wayside as we contend with a spending bill. This is a manufactured crisis. It didn't have to be this way. Congress has abandoned its attempt to reform how pharmacy middlemen operate in an upcoming package to fund the federal government. 11 lobbyists and sources have told the medical newsletter Stat, and there's a link to that article if you want it. If there were universal health care, say a public insurance trust that paid all the claims to private providers, then all the drug prices could be negotiated by that insurance trust to fair levels without the interference of pharmacy benefit managers standing in between and taking their cut on every transaction. Let's remind our senators and members of Congress that universal health care means all the prescriptions are negotiated to a fair price for all of us. Their contact information is down below in the resources section, or you can use ResistBot and text SIGN, S-I-G-N, space, PHXILT, to 50409, and here's the email you'll be sending. I'm your constituent, and I am so disappointed that the Congress has given up creating legislation to rein in pharmacy benefit managers who increase the price of drugs in this country by taking bribes and who determine what drug is right for you instead of your doctor. Solve the problem this way. Pass universal health care, like H.R. 3421, the greatly improved Medicare for All Act, and we can negotiate all the prescriptions for everyone, all of us, urban or rural, cradle to grave. And we're going to save hundreds of billions of dollars over what we spend now, according to the Congressional Budget Office. And that's in year 1 of implementation. Okay, big deep breath. Let's talk about a medical school tuition gift. According to the Wall Street Journal, the Albert Einstein College of Medicine will now be tuition-free for all students, thanks to a historic $1 billion gift from a former faculty member and chairman of the board. The donation comes from Ruth Gottsman, who, after joining the faculty at the Bronx, New York-based Einstein in 1968, developed widely used tools to screen children for learning problems and launched an adult literacy program. Gottsman, who's 93, and her husband, the late billionaire investor David Sandy Gottsman, were longtime donors to the medical school, and Ruth Gottsman serves as chair of its board of trustees. Einstein's tuition this year is about $60,000, and the school recommends that students budget at least another $35,000 a year for living expenses, books, and other incidentals. The program lasts 4 years. Did you get that? That's about $400,000. The program lasts 4 years. Students assembled Monday morning to hear Gottsman announce the gift, and they jumped up to hug one another and cheered and grew tearful learning of their new financial fate. Let me tell you a story. Not so long ago, my wife and I were in Croatia, and we were discussing cultural differences between our country and Croatia with the tour guide. The subject turned to education, and he told us all education was available to all citizens without cost, even medical school. You can go as far as you want to go. Their tax burden, though, is just like ours. It is an identical percentage. They just choose to spend their tax money investing in the future. Word to the wise. Okay, that's what I've got for you today. Down below, you can like, share, subscribe, send me a comment in the comment link, or you can send it to healthcareadvocacy1@gmail.com. Thank you. Talk to you tomorrow.